Hey, it's Dr. Snider with Pro Health Center. I just want to take a few minutes and talk a little bit about cholesterol. And really, I want to give you a couple great insights that most people don't know about cholesterol. Because if you have high cholesterol, there's usually one of three major drivers of high cholesterol. And so I just want to take a few minutes and talk a little bit about this. First of all, most people don't understand that cholesterol is very, very important in the body. As a matter of fact, most of the brain is made up of cholesterol. Nerves there's a lot of cholesterol surrounding the nerve coating. And so cholesterol is used to make hormones. And so it's got some very, very important properties and purposes. And so, we see a lot of, driving low cholesterol and statins and things. What most people don't know is, number one, is that cholesterol is actually made in the liver. And so the liver is actually going to make about 70% of your total cholesterol. So when we look at lab work and you think about cholesterol and total cholesterol, and everybody's worried about their number, for the most part, 70% of that number is actually what's going on with the liver. And it really gives us a lot of insight into what's going on with the body. And so when we see patients with high cholesterol, there's three major drivers of that. Number one is usually we think of blood sugar, okay? And so blood sugar has a lot to do with cholesterol. The more blood sugars are elevated, typically the more cholesterol you're going to have. And part of this is because, number one, blood sugar is very damaging to the arteries. And so cholesterol is used to rebuild and repair damaged artery walls in the vascular system. But there's a lot more to cholesterol. And we'll talk about that on another video. But at this point, I just want to hit kind of the three main topics or reasons why we have higher cholesterol. So blood sugar is definitely number one. Number two is going to be inflammation. Okay, and so inflammation is another big one. And so when the person is inflamed, the more inflammation they have, the more we've got damaged tissue and the more we have a need for repairing that damaged tissue. So inflammation is also a very big one as to why we would have a higher cholesterol. The last one, and probably the biggest unknown that most people don't really grasp about cholesterol, really boils down to decreased thyroid function. Okay, and I would say that one right there is a major one. Most people don't actually understand how much thyroid function has to do with total cholesterol and cholesterol levels. And so remember, thyroid hormone has a lot to do with how the body's metabolic processes are working, how the metabolism is working. And so when we have lower thyroid function, we have a slower metabolic process, we have a slower metabolism, we don't heal, we don't repair damaged tissue near the way we should. And so what we have is we start seeing a backup of cholesterol in the body because the body is not using it as fast. And so this is a major one that we see a lot of. And a lot of times patients will come in with a low or high cholesterol, but their thyroid labs are normal. But typically there's still a reason for a lower thyroid function, and some of that has to do with inflammation and blood sugar. And so we always want to kind of address that and kind of dig deeper to that. But this is a huge secret as to why people have high cholesterol. And so sometimes patients will come in and they'll say, well, I cleaned up my diet. I ate a heart-healthy diet, and we still have the high cholesterol. Because even in that case, we're not really addressing one of three or more of these different reasons and purposes for higher cholesterol. So like I said, if you have high cholesterol, it's always good to kind of dive deeper, figure out what's kind of driving that. It may be a blood sugar problem. It may be an inflammatory problem. It may be a thyroid problem, but we really need to understand kind of what's going on there. And once we can address that, what you'll start to see a lot of times is that cholesterol drop. Now, there's a lot more to cholesterol, and we'll do some follow-up videos later. But like I said, if you just stick with me, understand, if you have high cholesterol, these are three areas that really need to be looked at, really need to be assessed, because it always is an indication that there's more going on to the story. And so while we've been taught that cholesterol drives heart disease, A lot of times it's really the inflammation that's driving the heart disease, and the cholesterol is just a side effect of that. And so what we have to understand is kind of what is driving this. So if you have any questions, feel free to shoot us a comment or a post. We'd love to hear from you. But like I said, some definite things to look at if you're dealing with high cholesterol. Thank you so much.